So the Center for Ethics Education, which is directed by Dr. Celia Fisher, was established in 1999 as an interdisciplinary cross-campus unit at Fordham. So our center draws on the university's overlapping communities of inquiry, instruction, and faith to foster moral leadership within Fordham and within the communities of New York and beyond. So our programs include an interdisciplinary master's degree program in ethics and society, an advanced graduate certificate program in healthcare ethics, the HIV and Drug Abuse Prevention Research Ethics Training Institute that has provided a significant amount of support for our talk series, and an undergraduate bioethics minor, among other programs as well. So the Ethics Center embodies Fordham's commitment to intellectual excellence, social justice, and human dignity through the promotion of ethics education, research, and public dialogue on issues of contemporary social import. And so this brings us to today's conversation. So I just before we introduce the speakers, I just wanted to say a little bit about the procedure for this session. So I'm really excited about the turnout tonight, and that this new online format has enabled us to broaden the reach of our programming. And so we do hope that you'll be part of the conversation with our three panelists. And we're going to be excited to include questions and contributions from the audience. And in order to do so, we will be using the chat function in Zoom. So I'm sure that many of you are familiar with this procedure, but we have the chat function enabled for you to private message me as the host, and as the moderator, and then I will be asking questions to our panelists after their initial presentations, including questions from the audience. So we really do hope that you will contribute questions along the way. I'll be monitoring the chat. And if there's anything that you would want to ask of one or several of the panelists, do please share your questions. Okay. With that, I would like to introduce our panelists. First, Dr. Anthony Estreet is an associate professor in the School of Social Work at Morgan State University and the director of Morgan State's Health and Addiction Research Training Lab, or the HEART Lab, which is an interdisciplinary program dedicated to improving the health and addiction-related outcomes among diverse and at-risk urban populations. Professor Estreet has authored numerous articles and book chapters on issues in substance use, mental health, youth development, social work in urban developments, and he's the co-author of the forthcoming book, Trauma and Mental Health Social Work with Urban Populations, African-Centered Clinical Interventions. Professor Estreet earned his PhD from Morgan State, a Master's of Social Work from Virginia Commonwealth University, and a Bachelor of Science degree from Bowie State University. He is also a former fellow at Fordham University's Research Ethics Training Institute. Second, we have Gabriel Maldonado, who is the founder and CEO of True Evolution, a California-based community organization that fights for health equity and racial justice to advance the quality of life and human dignity of LGBTQ+ people. True Evolution engages in advocacy and provides services that addresses health disparities in LGBTQ+ communities of color, including HIV prevention and care services, a mental health and behavioral health clinic, and emergency supportive housing. In addition to his work with True Evolution, Maldonado was a former member of President Obama's Presidential Advisory Council on HIV/AIDS and serves on a number of regional boards, such as the Borrego Community Health Foundation and global organizations such as the AIDS Healthcare Foundation. He also works to advise industry leaders as an advisory board member for Viv Healthcare, Janssen Therapeutics, and Merck and Company. And then our final panelist for the evening is Dr. Kimberly Nelson, an assistant professor of community health services at Boston University. Professor Nelson earned her MPH in epidemiology from the University of Washington and a PhD in clinical psychology, also from University of Washington. Having both a public health and psychology background, Professor Nelson focuses on community and population level health implications while conducting individual level behavioral research. Dr. Nelson's research concentrates on psychological and structural factors associated with the transmission or acquisition of HIV among sexual and racial ethnic minority adolescents and adults. She is the author of numerous peer-reviewed articles on adolescent sexual health and other topics, and also completed a fellowship at Fordham's HIV and Drug Abuse Prevention Research Ethics Training Institute. So with that, I would like to let our first speaker say a few words, and so we'll let Anthony Estreet take it over.
Thank you so much, Stephen. So good evening, everybody. It's so nice to see everybody with their cameras on. You know, I've been doing Zoom for a minute now, and, you know, sometimes camera on is pretty optional. So I do appreciate you if you have your camera on. If not, I also understand that too, because I have two small school age kids that will literally run into my room and be on the camera at any given time. So I completely understand where you're coming from. So tonight's talk is going to be about social justice and COVID. And I was talking to my colleagues before you all were allowed in the room that when we first started talking about this conversation was going to go very different. But then the events that are going on within the past couple of days have certainly shifted the tone and the topic of this conversation. So I'm going to speak about kind of my experiences and how it has impacted the community that I work with in Baltimore City, and also kind of bring it back to, you know, kind of current events. So I am a social worker by training. I am licensed in the state of Maryland, and I also do research in the area of substance use and HIV with an overall focus on improving wellness within the Black community. So I'm going to start off by telling a story. So let's say this story started back in November. You know, we started hearing whispers of this virus that was coming over and being transmitted in Wuhan, China. You know, in the United States, we really didn't pay too much attention to it. And in fact, in January, I traveled to South Africa for 2 weeks. So, you know, that's how much it really wasn't a thing for us, right? I come back from South Africa, and, you know, more and more news is coming up about the coronavirus. And then, you know, we hear more and more people are getting infected. Then it actually comes to the United States. Everybody is talking and really, I guess, looking at how other countries in the world are handling it. And, you know, especially Italy. Italy was the one that was really hard hit in the beginning. And everybody was like watching and saying, oh, you can't go to Italy. We even had, you know, President Trump say, oh, you can't travel to Italy. Fast forward to where we are now. We are leading in the number of cases. We are leading in the number of deaths, and our mismanagement of this virus has just been, to be completely honest, I don't have the words for it. And the reason why I say that is because a lot of what we're seeing about the coronavirus has literally impacted the African-American community to a large degree, to the point where, you know, we have higher incidence and higher deaths when it comes to the coronavirus. But then you take that into consideration, right? We're also talking about the issue of social justice, right? So we're, you know, in the African-American community, we're dealing with two pandemics, right? And that's the issue of police brutality and the issue of addressing COVID. I will never get used to watching the execution of a Black person on TV. That's never going to be a thing for me. Like, whenever it comes on social media, whenever it comes to TVs, I turn it off, right? Because we're basically becoming numb to the idea that Black people being killed by police officers is kind of a thing. Yes, there's protesting, but what changes have been made, right? So when we think about how we are addressing the issue of COVID and the issue of social justice, it is literally the idea that people have to put themselves at risk and exposure to COVID-19 to go out and protest the idea that it's not okay to kill Black people as a police officer. And I'm not saying that Black people are the only people that are killed by police officers. However, it is becoming quite more of that storyline, right? And that we're seeing it more and more in everyday society. I mean, there was literally I think there was one earlier this week of a man who spoke out in favor of the police and then ended up becoming a victim of being killed by police, right? And so when we think about how this impacts the community as a whole, you find that it's numbing. I mean, to be completely honest, it's numbing. For me, one of my roles is to provide therapy, and it is a challenge to provide therapy, to be in a space where you are mourning the senseless death of Black people, and to also hold space for people that are mourning the senseless death of Black people. So it's almost as if you have to put your own feelings on hold to address kind of what's going on in the community. And to me, that's a hard thing, right? It's becoming one of those things where we're having to hold space to deal with people who are stressed out about the impact of COVID. We're having to hold space for people who, are nervous to interact with police officers. We are having to hold space for people that have lost their jobs, that have, lost loved ones to COVID. I mean, I'm in Baltimore, so we have Hopkins is right down the street, and University of Maryland, which are two large medical systems that in the state of Maryland were kind of the hot spots where people were going if they contracted COVID in the first beginning. So, to think that, we were in a space, and we're kind of still in a space where people who contracted COVID had to die alone. And then we have the president taking a joyride to wave at his voters or his supporters. That tells a very different story, right? And it really tells a story of privilege, honestly, those that have it and those that do not. And that's something that we have to kind of always think about in the work that we do. When COVID hit, and most states were on stay-at-home orders and all that good stuff, or lockdown, as a lot of people call it, that really impacted people that were experiencing substance use disorders. And what I mean by that is, think about those individuals that had to access methadone or medication-assisted treatment on a daily basis. How are they going to get that? And then we talk about the idea of transportation being shut down because bus drivers also didn't want to catch it, so they rerouted a lot of public transportation. So COVID in itself highlighted a lot of deficits within our system, but also highlighted a lot of disparities within urban environments and other environments. In particular, Black and white, right? Because in those instances, Baltimore was hard hit. And even still now in the state of Maryland is, I think, at stage 3, but Baltimore City is still slowly at, I think, stage 2 now, because we can't afford to respond the same way that other people are responding when it comes to COVID. We have to think about, what that transmission process looks like, and it's based on science. And I think that for the idea of social justice, it really highlighted kind of what that looks like. So an example is, prior to COVID, telehealth services were not allowed for people that had Medicaid or Medicare. Since COVID, that has been allowed. And what we've seen is that there's been an increase in people seeking care, whether it's primary care, mental health care, substance use care, that those rates have went up because now we've provided access. People don't have to travel an hour and a half to 2 hours to get to their doctor. They can access those services immediately by scheduling an appointment and turning on their screen. But what we also saw is that in terms of access, not everybody had equal access to internet, right? So that idea of, we could just go to telehealth was a great kind of pivot, but it also wasn't an equitable response because not everybody had that kind of ability. And I think about now, when we talk about just the ability of people to, be on a call like this or to finish school like this, not everybody has those kind of abilities. And when we think about the way that COVID has impacted and highlighted these social justice issues, it creates an issue where we are seeing people who are protesting, where we are seeing people who are coming out and speaking out against the policies and basically how it's being handled. I mean, we just saw, was it last night, where the president suspended talks about the economic relief, but then he came back and said, hey, I'll give you $12,000 for each person if you sign it right now. It's as if bargaining with the survival of the economy is a bargaining chip. So when we think about how that looks in terms of social justice and disparities, it kind of makes you sick to your stomach, right? Because some of us are privileged enough that we don't have to use that $1,200, but then there's others who rely on that $1,200 for their next meal. There are some of us who that $1,200 can mean, another month of not being homeless, another month with your lights on. But we're seeing it played out in politics as if it's a bargaining chip, which, when we think about that is not how, if we want it to be fair and equitable, that's not how it should be. And, that raises concerns in terms of just the idea of how well we are able to respond to COVID, but even more so, what does that look like in the future for addressing social justice issues? I think, and I mean, to be completely honest, I am thinking about the rate at which we're hearing more and more of these stories of police brutality and the killing of unarmed people in the news and on social media. We're getting to a point where it's almost every day, if not, it's almost every week, if not almost every day. And so when we think about that, what does that look like in terms of our society? What does that look like in terms of addressing that? And what is the solution? Certainly me and my team have been thinking about it and engaging in policy and advocacy and protests, but at what risk, right? I don't know how many of you all have engaged in any protests or had the opportunity to, be out in the community to do grassroots work. But, oddly enough, as many of the protests that I've been a part of, it has not been a super spreader event, kind of like we've seen at the White House, right? People are essentially protesting responsibly. They have their mask on. People are using hand sanitizer. People are genuinely protesting in a way that is safe, but also to get their message out. And then in one event, we see how much and how quickly COVID can spread when mismanaged. So, I say all that to say, when we think about the impact of COVID on social justice issues, we certainly highlight and see how it has impacted healthcare, how it has impacted access to care, and both a positive and a negative, right? So on the one side, COVID did provide access to a lot of people to be able to access different forms of healthcare. We've seen the relaxation of prescribing roles for methadone and medication-assisted treatment. We've seen the ability for people to be innovative when it comes to addressing treatment, right? So, different forms of treatment that used to have to require a person to come in can now be done remotely, and people are showing up. So people are actually doing more services through telehealth than they were when they had to travel and come in and take time out of their day, because it makes it easier. But on the other hand, we also seen that COVID has been used as a way it's been used as leverage, to be completely honest. And, we have to think about what that looks like ethically, because I think that, regardless of what side of the line you fall on, Democrat, Republican, the idea of using COVID or relief or care as a bargaining chip for the American people, is gross, to be completely honest. And I know that I am coming up on the end of my time, so I'm going to turn on to Gabriel in a minute, because I can talk on this all day long. But feel free to ask me questions later or think about your questions, and we're all going to come back and have a glorious conversation, because I do want to hear from you all as well. So I'm going to turn over to Gabriel, who's going to talk about some of the work that he does and what's going on over there in Cali.
Thank you, Anthony. Appreciate it. So good evening, everyone. My name is Gabriel Maldonado, and I serve as the founder and chief executive officer of True Evolution. We are located in Riverside, California. And if anyone's unfamiliar, Riverside is located in the boot of Southern California. So if anyone's ever heard of Palm Springs or the Coachella, right? Come on, you should know Coachella. That is nestled in our county jurisdiction. And we serve two counties, Riverside and San Bernardino. And our jurisdiction, our region, is known by HRSA, the Health Resources and Services Administration, as the Inland Empire. That's sort of our term. So if you hear me say Inland Empire, I'm referring to this two-county region that we service. And this region is 27,000 square miles, which is important to part of our conversation when we talk about health disparities and social determinants. We are larger than 5 states in the US, and we are the single largest jurisdiction funded by HRSA in the United States. So we talk about access to transportation, access to healthcare services, access to affordable housing. You add in a rural component, it's a separate conversation. But that's not where we began. I'm originally from Compton, California. So I grew up in the CPT, and that is very important because I've also been a community organizer for the last 15 years. And through my work, I have seen not only as it relates to some of the crime and some of the stereotypical experiences of what it was like to grow up in a hood, all those things are real. And but the other aspect to growing up in Compton is the industrialization of urban communities. And that is sort of where my community organizing work with social justice first intersected with health equity. So many communities all around the country, I'm speaking of Compton in particularly, are impacted by refineries, chemical factories, logistics companies, smog facilities, and it resulted in my entire family, including myself, coming down with a form of cancer. My brother has been battling with a rare form of spinal cancer and is now a paraplegic. Our dogs died of cancer. My stepfather has cancer. My mother had stomach cancer. I had a benign tumor. And, many people in my neighborhood came down with lupus and other forms of tumor-like cancers. And, to this day, nothing has been done about it. For those who know the reference, no Aaron Brockovich ever arrived, for anyone who knows the movie. And so, that was really one of my first experiences with witnessing firsthand the impacts of racism and social justice played in the context of your environment and environmental justice, and how that intersects with some of the health disparities experienced in Black and Brown communities. But at the same time, I grew up in the 90s. And in California, particularly Los Angeles in the 90s, there was a whole new kind of world where these neighborhoods in Watts and Compton and South LA have historically been African-American and Black, all of a sudden had this huge influx of people from various parts of Latin America, South America, El Salvador in particular. Many of them were fleeing some of the social conflict that was taking place in Latin America throughout the 90s. So all of a sudden now you have communities that are Black and Brown cohabitating with different languages and cultural practices and the same traumatic experiences with protecting your home and protecting your neighborhood. And that energy came in at the same time. And there was an enormous amount of gang violence that took place. And many people today are familiar with Mara Salvatrucha or MS-13, which is one of the largest gangs in the United States currently. And their homes and grassroots. I remember the first time seeing their gang tags for the very first time in 98, 99 when I was in middle school. And, those were also a big part of my social justice experience as a community organizer. But as someone who is biracial, someone who is both Black and Latino, growing up in a community where you were either Black or Latino, and sometimes not choosing one or the other could be a death sentence in certain experiences, and identity is where you find your protection. All of these experiences in my high school life really kind of led up to coming to UC Riverside, University of California, Riverside, where I did my undergraduate. And it's about 2 hours away outside of Los Angeles, heading east in the area of Riverside. And when I first was driving my little Ford Explorer, getting off the freeway, trying to check into my dorm, I was greeted in 2007 by signs outside of a Greek Presbyterian church that says, "God hates faggots." And this was in 2007 during the onset of the Proposition 8 campaign, for anyone who's familiar. So we in the courts were able to achieve marriage equality. And then there was a ballot initiative that was proposed in which our citizens, actual members of our constituents, actually placed a vote. This was not powers of some type of foreign lobbying, but these were actually people casting ballots, voted that indeed they believe that marriage should be upheld between a man and a woman. And my county in particular, which is one of the most conservative regions in California, voted at nearly 72%. So that tells you, for a young person who is trying to come out, a person trying to find their identity, particularly a person coming from a whole set of traumatic lived experiences, trying to now understand what does it mean to be in a society that hates you and that does not believe that you are worthy. And so in 2008, I founded my organization, True Evolution. And for the first few years of our work, we were focused on advocacy, specifically organizing Black and Brown youth. And I've always believed that the education system is the first place that we can put our hands on the next generation. And so that's where we began. In the early part of our work, we thought that by helping youth navigate high school and providing them career access and giving them opportunities for employment, that was going to be our best way to contribute to achievement for our people. And I discovered very early on, working with youth for the first 5 years, that many of the population that we serve are really at the beginning stages of the most basic and fundamental needs, having to deal with parents that are drug addicted, or having to experience homelessness and going to high school by living out of the motel, or experiencing sex work and having to use various forms of economy in order to survive. These were some of the experiences that our population experienced before they could even think of going off to college. Thinking going to college and bringing up college was actually a spit in their face. Did you not see what they just came from? And so in 2011, my organization completely turned around our mission statement to not just be an advocacy organization, but we became a direct service provider. And for the last 10 years now, we have grown our direct healthcare services to, as Stephen has mentioned, to include our HIV services, our mental health clinic, which is one of my crown jewels that we have built out as a mental health clinic. And now we have a housing program, which is going to be our largest flagship program in 2021. Regarding COVID, when COVID-19 happened in March of this year, our governor, Governor Newsom, put a stay-at-home order that mandated that we all shelter in place. What it also did is it enacted a particular mechanism that required all counties to immediately house their homeless population. Now, you can imagine this would be nearly an impossible feat for most counties, and most of us in the country. If we would have done it, we should have done it a long time ago. And I live in downtown Los Angeles, and just 2 blocks away, there are encampments, or I call them refugee camps, of Los Angeles by the droves. And so the County of Riverside prioritized 3 major populations: seniors, pregnant women, and people living with HIV, or those that were experiencing comorbidities. Our region only has 4 HIV social service providers, and True Evolution was the only agency that was able to take on the scope of work. We were not offered any funding. There was no guarantee of resource of support. It was either you rise to the call or you can't. And we tried. And within the first 2 weeks, we identified over 72 people living with HIV who were absolutely missed in the homeless count that was most recently done just this past June. It broke headlines. It was considered a major revelation to have that many people from this particular subpopulation all homeless, and it was only revealed as a result of COVID-19. What it did subsequently is, and the name of this initiative to completely house the homeless was known as Project Room Key. That was the name of the housing initiative under the state of California. Subsequently, Governor Newsom created an initiative known as Project Home Key. This is the second iteration of Project Room Key. So we went from Room Key to Home Key. So Project Home Key. This is a $600 million funding. $550 million comes from COVID-19 CARES Act funding, and $50 million from the state of California's general fund. And its purpose is to purchase and rehabilitate all kinds of existing structures like hotels, motels, and existing abandoned structures to create permanent and transitional and affordable housing. So True Evolution, we are so excited because we were awarded $4.2 million from the state of California to convert what we are going to lead as the state's first ever community campus. So it is going to be over 1.5 acres of 20,000 square foot facility that's going to have 50 beds of 2 years of transitional housing. It's going to have 2 community gardens. It's going to have a fitness center. It's going to have a primary care clinic. It's going to have a mental health clinic, and all of our workforce services will be all located on one site. I bring all this up to you and I tell you this whole story in my closing remarks is because for me, the only way that we can begin to achieve true equity and really try to achieve a better world is by looking at the key social determinants of health that are impacting people's daily lives. And for me, that is housing, mental health, workforce employment, and primary care services, access to basic health care. And those are the 4 pillars that I lead with and how we build our services and our programs and our advocacy. And so that's a little bit about who we are, the kind of work that we're doing right now, and sort of the basic framework of how we approach public health and health equity. I'm going to turn it over to my colleague now, Kimberly Nelson, who is brilliant and amazing, and I can't wait to hear her. So Kimberly.
Brilliant and amazing. Oh my goodness. I don't know if I can live up to that. I should also preface this. There is a big thunderstorm happening at my house right now. So we're going to keep fingers crossed that my power stays and I don't lose my internet. I just want to give a huge shout out to Anthony and Gabriel for setting it up so nicely. I'm going to talk about adolescents because that's what I focus on in my research. And I really focus on helping adolescent voices reach the people that need to be spoken to. And so my research really focuses on youth advisory boards and gathering both actual quotes and the words of youth, along with a lot of data about how youth are experiencing their world. And I specifically focus on sexual health with the idea that there are so many incredible disparities that are happening for youth in our country that are all really, really just because of the foundation of inequality that happens. And so LGBTQ youth, racial and ethnic minority youth are disproportionately affected across the board by sexual health disparities, by mental health disparities, by housing disparities, by employment disparities. It is pervasive. So everything that you can think of in terms of what Anthony and Gabriel were just speaking about is impacting the youth that are in this country as well. And so when I first started hearing about COVID and first started thinking about COVID, it was a very similar story to Anthony. It was like these little like whispers, like, ooh, and I have an epidemiology degree, so of course I nerded out about it at first. I was like, ooh, interesting, new infectious disease. Let's see what happens with this. And then of course it did what we all know it did, which is it does what infectious diseases do best. It infected a lot of people because if you don't take care of it, it will prevail. And we didn't take care of it. We didn't even come close. As a country, our response has been, in my opinion, abysmal. We had the tools and we didn't do it. And that's going to haunt us, I think, for probably entireties of all of the lives of the people that you see on your screen today. And it is disproportionately and unabashedly affecting our adolescents in the US. It is that shutdown that happened and the shutdown of schools that happened for youth in this country drastically impacted their lives. It impacted their schooling, it impacted the way they interacted with their peers, it impacted the way that they interacted with the educational system, and it impacted the way that they were able to access or not access their health services, including, as Gabriel and Anthony mentioned, mental health, substance use treatment, and what I am particularly focused on is sexual health care services like HIV and STD prevention. And as Anthony mentioned, it hasn't been all bad. Some of it has been good. Some of it has led to really interesting innovations in the way that youth are able to access services. But some of it has been really hard, and it has been disproportionately affecting particularly LGBTQ youth and those who are at the intersections between LGBT and racial and ethnic minority. For those youth who are now stuck at home or stuck in a family situation where they may not be out to their family, they may not even have anyone supportive within their bubble that they're living in now, and they can't easily access even through the internet services or social connections without fear that their family, who they believe may not be approachable or accepting of them, might find out. And so I happened to be actually running a study right as COVID hit. And I was running the study, I do mostly internet-based research. And so I was able to add a lot of questions for the youth about how COVID was impacting their lives. And this was particularly a study of 14 to 17-year-old sexual minority males. And sexual minority was defined very broadly. So this was youth who didn't have to be sexually active. They just needed to either be attracted to male partners or identify as a sexual minority, so gay, bisexual, queer, etc., or have had voluntary sexual contact with a male partner. So very broad definition, which is appropriate for adolescents because adolescents are just working out who they are and who they're interested in. And so we collected qualitative data. So we actually collected open-ended questions about how it was affecting them, if they were isolated, who, what was happening for them, and then how it was specifically impacting their sexual lives. And it was very devastating what these youth had to report. A lot of feelings of isolation and feeling unsupported and incredible amount of stress because of the switch to virtual school and not feeling like they had the support that their school was providing to them previously. Increased depression and anxiety, all of the things that you can imagine as an adult you would feel. But for youth who have even less resources, both sort of cognitively, but just like generally resources, these youth were losing their jobs because who's going to lose their job first? It's going to be youth who are, hourly workers for the most part, maybe the first ones in, right? First one in, first one out. And so these youth are reporting that they are losing access to all of the things that were keeping them and making them feel sane and safe. And interestingly, it didn't actually appear for this particular group that there were racial and ethnic disparities in that. This was across the board. And I actually think that that might have been because this was pretty early on. I think if we kept collecting data, the disparities that we see that are happening in terms of health outcomes around racial and ethnic minority youth are going to start really showing up as COVID keeps going on. Because that privilege that Anthony was talking about is real. Those white kids are going to be doing better because they are just inherently in a privileged position. And it's just upsetting, to be honest. We could have done so much more and we really didn't. And I want to say that I'm hopeful because I'm generally a hopeful person, but it is incredibly hard to be hopeful at this moment. And then you add in the increasing public displays of violence around and against Black individuals and the mental health toll that is happening among all people around that. It's just heartbreaking. And I know that we say that this is like a dual pandemic, but that violence against Black people has been there. That's not new. That's not a new pandemic. It's just now getting a lot of press, which is good, but this isn't new. These disparities aren't new. It's just now we're seeing them on the front line, which is good. We need to see them and we need to acknowledge them. And I'm glad that that the protests are happening and that we're getting those voices out there. But there is a part of me that's bothered when people say that this is like that like racism is a public health, it's always been a public health concern. We're just now talking about it. So I'm gonna end there because I think that we probably have a good amount to chat about around that. And I'm super excited to be on this panel, and I want to thank Stephen and Celia for inviting me to be here.
Thank you all for those opening remarks. That's a lot to chew on, and I'm hoping that if there's anything else that all of you want to touch on from what somebody else said, you're welcome to go ahead and interrupt and jump on that at any point. So I wanted to start off with a general question about disparities and COVID. So, there has been an acknowledgement and a recognition that communities of color, and in particular African Americans and American Indian and Indigenous communities, have been hit especially hard by this disease. And so especially in the early months of the pandemic, there was I think, a remarkable amount of media coverage that at least mentioned these health disparities, right? It's not clear how much they actually, dug deeply into the health disparities, but it was something that was, I think, remarked on and mentioned a lot. But the discussions were often focused just on health outcomes, I think, and the disparities in health outcomes of the pandemic. And so I think that this focus just on the health outcomes might have ignored or perhaps set aside a lot of other social justice issues that are implications of the ongoing pandemic. And so I just wanted to give you an opportunity to talk about things that you think have been missed in this conversation about social justice and COVID. And in particular, what do you think is something that doesn't get enough attention when it comes to the social justice implications of that pandemic?
So I'll take a stab at it. So I think that it goes back to what Gabriel was talking about, right? When we're talking about social determinants of health. And for me, when I look around Baltimore City, right, which is an urban hub in Maryland, I see structural racism everywhere I look. When the areas that we're in are considered food deserts, and the areas that there's not a place to get fresh food and fresh fruits, and every corner has a liquor store. I think about how that was by design, right? And when you add that in terms of just health outcomes in itself, and then add that with COVID, I can see how the health of African Americans needs to be improved, and why we have existing health conditions, and why we're at greater risk for high blood pressure, diabetes, cardiac issues, right? So when we think about how we're looking at social determinants of health, we have to take that in consideration. Baltimore City has had numerous cases when it comes to lead paint poisoning because of just the lack of upkeep for the infrastructure. And so when we talk about these issues of COVID, like we have to talk about the other structural racisms, right? Kimberly was talking about the youth, right? There are youth who depend on the school system for their 3 meals, right? And when we think about how COVID shut down the schools, right? We think about how COVID impacted that. Schools had to figure out how to keep themselves safe and also provide meals for these students. It breaks my heart to think that, we have these resources, we have opportunities to change some of the things that we have, or how we can change outcomes. And I am so excited to hear, just with what True Evolution is doing with the community garden, right? The idea of growing your own food in these urban environments makes me excited. And I say that, right, because I'm a new gardener. Because of COVID, I started gardening this summer. So I feel like I know how to do a little something now, right? So, the idea of this community garden, or, getting the community involved in taking care of themselves, or including the community in these decision-making processes are large, because we can sit here and talk about outcomes all day, but from experience, and I'm gonna tell you this as a Black man working in the Black community, just because you're Black doesn't mean that you're gonna be welcomed by the community. If you're not doing things for the community, if you're not involving the community voice, if you're not involving community leaders, just because we got the same skin tone don't mean that you're automatically going to be on the end game. So you have to work to build that community. And once you build that community, make sure that the community sees your presence, make sure that they understand, the work that you're doing, and incorporate that into everything that they want to make sure their voice is heard.
So Gabriel, it seemed like you were reacting to that. Did you want to say anything about that?
Yeah, no, I agree. I agree. I think my comment is a little different angle, and maybe it could be because I'm feeling triggered by the conversation I just had with my father before we started this. So maybe I'm just being triggered right now. But I think that there is a philosophical conversation as a democracy that we need to have around how we see citizens, how we see our role in the democracy, in building and co-creating a civilization, how we see the welfare system, how we see income inequality. And really it's this notion of re-examining our relationship with capitalism, right? And re-examining how that has impacted our world. And the reason why I tell you this and I go to that is because there are so many examples that I have found, particularly on the policy side, when we look at the implementation of public funding. And what happens often is that when we look at it in its legislative framework, it looks one way. And then when you get down to the regulatory framework and the implementation at the administrative agencies, there are so many subtle elements of these sort of capitalistic driving forces that make the implementation of public funding and the implementation of social services absolutely stark, does not address, it was not the vision that we had for it. It does not happen. And it's often because of how we see government and how we see the role of government and the role of our dollars and giving in philanthropy. So, I mean, that's a little deep, right? And I don't know what you can do with that, but I think this is an intellectual space, this is an academic space. And I think it's incumbent upon all of you here to not just be looking at practical solutions, which I'm a big believer in practical solutions. I'm going to talk about that more than I'll talk about theory, concept, and frameworks. But I also think that since this is an academic space, I am looking for the next generation and the current instructors to really help us reimagine thought around how we should be seeing our role in society as it relates to investing in these issues. And I think that's something you all can do that I am not in a position to influence. You are all in a position to do that. So that would be my comment.
I'm being distracted by an incredibly cute child. Hello.
Me too.
So as you all were speaking, I was thinking a lot about how we've created these systems like the schools that have become these insane catch-all systems, right? Like, I feel like if COVID has done, it's done so many things. I was going to say if COVID's done nothing, but that's ridiculous. That's a ridiculous statement. COVID's done so much. But one of the things that it's uncovered is the amount that we are relying on certain systems to do the lion's share of taking care of health disparities. Like the amount that schools are relied upon to catch developmental delays and feed everybody and catch any sort of behavioral concerns, you know, make sure that our kids are getting their vaccines by requiring vaccinations. It's like a laundry list. You put that at the same time as what is being also put on police in our country. And it's like the amount that they're supposed to be taking care of that they have no business taking care of is ridiculous. And I think that both the anti-racism work and the social justice work and COVID are really uncovering the amount that we are relying on these institutions in inappropriate ways. And those institutions are breaking down because of it. In one sense, rightfully so, and should be dismantled.
So I wanted to tack on to something Kimberly just said, and if I get in trouble for saying this, then I get in trouble for saying it. I got really scared after I started to be able to sit quietly in the corner of certain rooms where I discovered the level of true insidiousness that is happening. This is not conspiracy theory. This is not me just making this up as a millennial. I have sat in the room at some of the highest levels of corporate America and in the federal government and have heard conspiratorial language that really kind of willfully and intentionally did things like create attrition programs. And I call them attrition programs because often when you have states, for instance, that are block grant Medicaid states, and you have to amortize your block grant Medicaid across the fiscal year, and you're trying to figure out ways that you can be able to save those dollars, you often put regulations or things in place that creates functional barriers to people being able to be eligible for programs, to accessing the full amounts. And these things are really discussed. And so I think for me, like, I am not just looking at how can we be proactive in putting forth and creating that which needs to be created, but what also strategy needs to be taken other than the vote, because even that is being manipulated these days. But what other strategies do we need to put in place to counteract the proactive insidiousness and the proactive conspiracy that is happening to continue on these inequities? And I don't have an answer for what that strategy looks like, but I just want to put that into the space.
You know, I think that Gabriel's right. We have to start addressing the income inequalities that is created through capitalism, right? So, you know, this idea of paying people a living wage, right? So everybody's talking about increasing minimum wage and all this good stuff. But the counter argument to that is, oh, well, if you increase minimum wage, then all the other prices are going to increase, right? So that is a product of capitalism, right? What about a gallon of milk has to increase because we're paying people more, right? Is the milk going to be different, or is it super milk? Like it's regular milk. But the idea is, if we put more money in people's pocket, we have to then charge more to get more, and that price can go up. So that in itself, you know, creates this ongoing systems of inequality. And the reality situation is, you know, going back to what Kimberly said, was the idea that we have these systems that are catch-all. So I think of the school system. I think of, you know, the way that we have the school system to basically engage youth in healthcare. You know, if we're really being proactive about what we're doing, you know, we would put a lot more focus and attention on prevention, right? Imagine if we put more dollars on prevention instead of intervention, right? People can't really access their doctor until something is wrong. But what if we can really put a system in place to get ahead? Like, think about it. If we had a system that was not a sick care system, but more of a prevention kind of healthcare system prior to COVID hitting, you know, we could have impacted a lot more people, because people would have came into the COVID healthier, right? The idea of health and wellness has really become buzzwords over the last couple of years. And even now, you know, you're seeing some healthcare companies do it just as a requirement. Oh, well, come get your free physical so that, you know, you can have no copays or something like that, right? They're trying to initiate this thing, but what other services can we do? So when we think about how we can, you know, it goes back to Gabriel's question. When we think about what kind of strategies we can put, we can start, you know, as grassroots organizations, teaching people about health and wellness. We can start teaching them about financial wellness. There are solutions, but it's literally, how do we implement that, right? Because I can tell you right now, having a behavioral health clinic in Baltimore City is very rewarding work, but it's also a nightmare when you have to deal with Medicaid, when you have to deal with the various policy issues. And like Gabriel said, the nuances between a person coming to get mental health can get, you know, 150 unsupervised visits. A person coming to get drug treatment can get 2 visits, and you have to call and make a case why they need more treatment, right? That doesn't make sense, right? If we're talking about this system integration of behavioral health, but yet they're 2 separate systems in terms of how you get authorizations. So those are the policy things that, you know, certainly impact practice, but also we need to take practice and make sure that we're taking it back to impact policy. Most practitioners aren't engaged in policy work, and most policy workers aren't engaged in practice. So there's a disconnect between those conversations that we need to bridge that divide.
So I'm actually curious about these policy sort of questions, and in particular, both when it comes to the bigger structural policies that we're thinking about, but also the policies that are direct responses to the current needs of the moment, like the pandemic. And it is pretty often the case that either because of obliviousness, or because of practical concerns, or because of, as Gabriel said, sort of like insidious design that's sort of built into some of these policies. Policies that are directed at trying to mitigate the exigent problems right now often ignore or exacerbate existing inequalities and existing injustices. So in addition to some of the things we've been talking about, I'm thinking of mask mandates, for example, and the specific ways in which the mask mandates in New York City were enforced differently in different communities. And this was sort of like obvious because you know that the way that, you know, police these different communities differently. And so you had, you know, in one neighborhood of New York, the police officers are handing out masks in parks to people who didn't have them, or, you know, gently nudging people who weren't socially distancing. And then in other communities, police were taking far more aggressive, actions at people who weren't wearing masks or people who were congregating together. And of course, this is predictable given, disparities in, law enforcement. And so I'm just curious about, like, have you noticed any particular policy reactions to COVID-19 that you think have specifically exacerbated these ongoing or these underlying inequalities, or have exacerbated these injustices?
I think a really classic example of what you're getting at, I think your mask example is a really good one, but so every hospital in this country that was dealing with any sort of surge related to COVID had to make rules around who got ventilators and who didn't. And the rules that they did were based off of essentially like what we knew about what would create increased mortality, right? So diabetes, obesity, like a laundry list, any sort of like pre-existing hypertension, etc. So who are the communities that we know that are disproportionately affected by those health concerns? It's the Black communities and the Latino communities predominantly, right? So just by making that rule based off of those health conditions, that is a unequal, unfair, disproportionate rule that is burdening and removing access to life-saving healthcare for those communities. It is basically punishing them for the structures that we have in this country set in place that made it to the point where they have those health disparities in the first place. It was very interesting. I work at Boston University, and which is affiliated with Boston Medical Center. And Boston Medical Center is the safety net hospital of Massachusetts. And the leadership at BMC, Boston Medical Center, came out with that rule because everyone else was doing it. And Boston Medical Center also has a huge social justice pull, and that rule got denied by all of the physicians within half an hour of it being posted. Within half an hour, all the physicians protested and said, we will not use that as our defining rule. Rethink it. And it's that type of movement that we need to see in healthcare, in prevention, in schools, where people call it when they see it and they say, no, we are not going to do that. So I think that point of thinking about sort of like the downstream effects of these rules and these policies that are built off of a racist structure, they're just going to keep building the inequities.
Any other contributions to that? Or, okay. Oh, Anthony?
No, I was going to say, I'm happy to answer, or, but I'm also interested to hear from the participants what kind of questions they might have, and, get them a little engaged.
All right.
I see some reactions when we say stuff. So, I think some people want to talk or chime in. So by all means.
Yeah, so I do have a question from the audience, in fact.
Okay.
So this is directed at Gabriel. So you had mentioned that 72 homeless people with HIV were identified in your community thanks to the methods that were being employed because of COVID. And of course, the governor's programs, the Project Room Key and Project Home Key, were direct results of COVID. Do you think that some of these positive results will be continuing after the pandemic subsides? Or do you think, are you worried about these efforts being abandoned once we have this under control?
Well, as of today, Project Room Key ends on November 5th. And 875 people who were supposed to be guaranteed all Section 8 vouchers, only 55 are going to get them. And what we are doing with the other 820, I have no idea. I can tell you what I'm going to do for my 72, but I don't know what is going to happen to the over 800 people now who were housed. I will say this. I champion and absolutely give kudos and uplift my housing authority and our Department of Public Health. I mean, shout out to Heidi Marshall and Carrie Harmon and Michael Walsh and Tanya Torno. I have to speak their names because they have done some fabulous work. And what they did was actually very different than Los Angeles and San Francisco. So how San Francisco and Los Angeles did it was they focused on economies of scale. So they focused on how do we get as many people in a unit as quickly as possible. So what they did was they identified 4 to 5 key sites in certain places in Los Angeles. You can imagine where those locations were. So they identified these large housing structures, abandoned hotels, motels that they reconverted and just housed people. So if anyone wants to Google City of San Francisco housing projects, meth lab, just Google that, it'll come up. And what's happened is that in these areas, they just focused on getting people in the units, putting them in. No one ever thought about supportive services, not in any real way, right? That wasn't the primary focus. No one thought about using the dollars to invest in the nonprofit infrastructure. What Riverside did is they invested in the nonprofit infrastructure. The majority of the Project Room Key money that came in went out to other subcontractors and nonprofit organizations, and we benefit in our infrastructure growth from these dollars. What that did was it allowed these 72 clients to not just be supported by these government dollars. They are also supported by the entire apparatus of True Evolution, all of our sources of funding, all of the many programs that we offer, and that really kind of creates a comprehensive approach to addressing the need. So to kind of pull in from the previous question and answer this question, I really do think that, it's not just about how laws within themselves are problematic or are helpful. It really comes down to the implementation. And I will tell you that it is most often the implementation where the majority of the problems and the exacerbated disparities can be found most often.
I've got a question for Dr. Nelson. So given the current situation, what would you suggest would possibly help the underserved youth that are struggling right now? Is there anything that can be done at this point, given the situation, to make a real difference?
Yeah. I think we have to support our youth. I feel like it's one of those, I almost want to set up like a buddy system. I want to be like, do you know a youth? You should reach out to them. But in all seriousness, this is a super challenging time. And I think the schools are trying their best for the most part to reach youth and to serve youth as best as they can in this situation. But I think the mental health concerns that are going to come up for youth and the long-term mental health implications of this level of developmental disruption it's going to be drastic. We're already seeing increased substance use among youth. I think there's likely to be increased sexual risk-taking, not while people are social distanced, but when that relax or when youth decide they're over it. And so I think I come from a place of prevention. And so for me, I think a lot about what are the things that we can set into place that will help youth have healthy behaviors from the get-go. Because we know that if youth start out with healthy behaviors, they're much more likely to keep doing healthy behaviors. And that's across the board. That's eating, that's sexual behaviors, that's mental health coping skills. And so I think if there are ways for us to help youth integrate and understand and use coping skills and really gain those skills during this time, I think that could have a drastically good impact on youth. Because I really do think that the depression and anxiety are likely to be a long-term concern. Adolescents who get depression are more likely to get depressed later in life. Adolescents who have anxiety are more likely to have anxiety later in life. And so if we can think about ways to support youth and get them either services if they need them or even simple skills, there's a lot of really great online skill-based, CBT-based things that we could try to put in front of youth to get them engaged. I think that that would be really helpful. I really worry about the youth who are isolated, like the youth who are, for whatever reason, because of their identity, are unable to be safe in their family. Those are the youth that I'm most concerned about. And I don't know what a good answer to that is, because I think reaching them could actually put them in harm's way. And so I get stuck. And I'm sure a lot of us feel stuck in this situation. But I do think that we need to really start thinking about it, attending particularly to the mental health aspects of this for youth. I mean, so much happens when you're a teenager. All of those milestones, they're not getting them. Like, it's just not happening. That's hard. Poor kids.
And then so on the other side of that, Kim, you know, I have to put on my social work hat real quick. One of the things that every social worker is concerned about right now are those youth that can't access school and can't access other services. So, you know, once, you know, people are back in school, the incidents of abuse and neglect are going to skyrocket, because right now they're not coming in front of anybody who's reporting it. So, you know, those instances of being at home where they were able to escape to go to school are no longer there. So that is a huge, huge policy concern, and a huge practical issue that is just on the forefront in terms of, you know, what does that look like in terms of services and providing those services once this all ends?
So we actually had a couple of other, you can jump in on this too, but there are a couple of other questions about opening schools and the conversation that we're having about the importance for youth of having schools open. So both, you know, clearly the educational value is a big part of the discussion. The developmental issues related to, you know, interacting with other youth face to face. And then the things that, you know, both of you are talking about when it comes to students who are at risk and how do we provide services for them. So I'm curious if, you know, any of you have comments or thoughts about, you know, either, you know, are these reasons to be, you know, forcing schools open, or should we be thinking about how to provide services and these other things independently of our schools?
I mean, can we do both? Like, I feel like the idea of forcing schools open sounds, I don't like it.
Right. No.
I don't like it for a lot of different reasons. But, you know, we know from an epidemiological standpoint, we know that you shouldn't be opening schools where there's community spread. Mm-hmm. Because that spread will happen in communities, and a school is a community. So you put a community within a community, it's going to spread. And that means death, right? That's not like a nothing thing, and it might not be death for the kids. It probably won't be necessarily for them, given what we know about COVID, but it could mean death for their family. And so now you're taking out their support system because you're opening schools in a community where there's community spread. And so, no, I don't think, I wish that every school could be open and open safely, but we haven't contained the pandemic in a way that we can actually do that. I think in communities where community spread is low, there are ways to think about doing that in a way that would be really safe and effective and helpful, particularly focused on reaching youth and getting youth in the building, like the youth that Anthony's speaking about, the youth who like really need those services. Like, we need to have eyes on them. We need to be getting food to them. We need to be like really addressing high needs kids, disabilities, unsafe homes, homeless kids. Those kids should be prioritized to get into those classrooms. And then we should create services that aren't contingent on the school. Because really, like, the schools are just overburdened in this country with the amount that they are required at this point to take care of. And I get it, because students are required to be there. But on the other hand, that's a lot to ask one institution to handle and to do well. So per Gabriel's previous point of like, it's about implementation, some schools do it well. Some schools do not do it well. And it's an implementation issue. I'm going to turn off to Anthony now because I know that he has things to say about this. Oh, and Gabriel. Oh, yay.
So no, I'm speaking from two lenses now, right? So as a parent, I mean, I'd be okay with my kids going back to school. I didn't sign up to be a teacher, right? So this online learning is an adjustment for all of us. If anybody had to do Common Core math, you know, it's just not the same as we used to do it, right? So as a parent, I'm like, you know what? I didn't really sign up for this, and this is not my strong suit. But you know, when I think of it as a researcher and practitioner, you know, similar to what Kim said, you know, some schools can do it effectively, but most schools cannot. I think about my 6 and my 8-year-old. You know, they've gotten fairly savvy at putting their mask on, social distancing. They know all the rules and things like that, right? But that may not be everybody's experience, right? So when we talk about access to information and how people use that information, we see people, adults currently, that walk around without masks on, that are anti-maskers, and they don't believe that COVID is a real thing, right? So that kind of mentality and mindset creates these opportunities for super spreader events. And the thing is, you know, we know that 9 out of 10 times our kids probably won't be impacted by it. But again, you know, I think about, you know, my kids coming home and then I become a carrier, and then they get in contact with my parents or something like that, right? So, you know, I think about how it's transmitted, right? And we have a real life example currently happening with the Rose Garden party, right? How a super spreader event can happen from one person that literally jumped, and now all these people are testing positive for COVID. So the risk is not worth the reward.
So we're a year away from the vaccine, okay, at minimum.
At least.
We're a year away at minimum. And if anyone is unaware, the fastest vaccine that has ever been developed was the mumps, and that was in 4 years. It was fastest ever. So I can tell you on average, from the discovery of the molecule to phase 1, phase 2, phase 3, FDA approval, it's 10 to 20 years, okay? And the reason for that length is not just because the discovery of the molecule and the development of the therapy, but it really relies in its safety and efficacy and its long-term effects. I am a person living with HIV. And for anyone who is familiar and knows the history of the HIV movement, we had AZT in the early 90s. And the side effects and the effects that people have experienced, it's a mixed bag, because there are people alive that I know because of AZT. Because of AZT, they are alive. But I also know that these same people are dealing with a whole host of long-term side effects. And when we think about pre-exposure prophylaxis, for those of you that are not HIV positive, PrEP may be an option for you, which is Truvada, a single dose regimen that prevents HIV acquisition by up to 99%. That also comes with its own host of effects. So this isn't just looking at, you know, people living with HIV, but this is just the impacts of medication and kind of the pharmacology around our bodies interacting with foreign medications and how that has impact on us. So, you know, to say that we are going to have a working therapy in a year, yes. Will Johnson & Johnson say that there is a therapy that is available to get submitted to the FDA? Sure. I think J&J will have something to submit to the FDA certainly by the first or second quarter of next year. Okay. Now, whether we want to take that or not, that's a different question. And I heard I can't not recalling the name of the scientist, but a famous scientist I heard said, vaccines do not help people, vaccinations help people. And so it's not just about the production of the vaccine, but it's about its accessibility, it's about its availability, and it's about its acceptability, the 3 A's, okay? So accessibility, acceptability, and accessibility. Yes, that's all of them. So if you can get all those 3, that is actually how you can introduce it into the population. And I think that to answer the question, because the horizon is so far away of when we're going to have a vaccine disseminated throughout community, it is incumbent upon us to evolve. We have to evolve. We have to approach this as though COVID is going to be here till 2025, like until some form of a herd immunity or some form of a full adoption takes place. We're here for a few years. So what does that look like for schools? Kimberly said it better than I do, but I would even expand it beyond schools and just look at civic life, just life, you know, how we do our voting systems, how we go to the grocery stores. I go to the gym every single day. I need that to be transformed. So, you know, I mean, there's a whole bunch of aspects of life that we have to look at reimagining. And I think it's the same thing for our school system.
So we actually have another question for you, Gabriel. So there was some question. Could you reiterate the pillars that you were talking about, and say a little bit more about them? And in particular, how do you think the pandemic has upset these pillars?
Yeah. So availability. So is it available? You know, is it there? So does the drug exist, right? Like the actual innovation to creating whatever it is needs to be created, you know, so that's the first step. And then the second thing is accessibility. You know, I mentioned that I live in a very rural region and it's very large or I don't live there anymore. I just moved to LA, but my agency is just a couple hours away and it's in a very rural region, and accessing resources is very difficult. So just because something exists doesn't mean it's accessible. Same thing with healthcare. If people can't afford it, it's not accessible. But then also, is it acceptable? Is it accepted by the community? You know, I remember in the real onset and the big around DACA and the undocu movement, you know, I had so many clients that were so afraid to go to any kind of medical institution or government run facility because there was a lot of fear about whether it was safe for them. So that you not only need to make it available, you not only need to make sure that it's accessible by community, but you have to ensure that it is indeed acceptable. And, you know, like Anthony said, I pointed it out when he said about, you know, just because you Black, that don't mean you designing stuff for Black people. And it's very, very true. It's very true. I'll tell you this, like my identity is not my Visa card to being able to do this work. And I always tell young people who are trying to get involved in activism, come into the room with more than just your lived experience. Your lived experience is valuable, it is necessary, it is a tool, but if you are there just to tell your story only, that is the full breadth that you are bringing, then there is a limited role for you. There's a limited role for that, because there is a great deal of translation that has to happen for the institution, the system, to understand what you are saying and to be able to conceptualize a response to it. So I think part of that, and when we create programs that are available, accessible, and acceptable, I can't just look at it from the framework of my own mind, because I am also privileged. I have a means of economy. I identify as a cisgender male. I am presenting as a cisgender male. I have access to a whole bunch of resources that my counterparts do not. So it's not just my identity. So, you know, really, as we are think tanking and as all of you are problem solving your own solutions and social justice responses, it is not just you. And you are not the representative of your whole population. And that sort of humility is absolutely necessary to be able to do this work in any real way.
So I didn't want to interrupt you because that was really, really fascinating and deep. But I think I misasked the question. So the question was about the four pillars of the determinants of social health.
Social determinants of health.
Oh, you going way,
yeah,
you going way back
yeah,
to the
sorry,
okay.
yeah.
You want to press real rewind on the conversation.
Yeah, sorry about that.
Sorry. My bad. I thought you were talking about what I just talked about. Sorry,
that was my bad.
I was going to the most recent topic. Okay, taking it way back. Okay.
Hey Gabriel, but I was going to say you were going in on that answer. I didn't want to interrupt you, but I figured what they were talking about too. But I appreciate that response too.
Yeah, I apologize. You know, this is my 7th Zoom call today. So, you know, it's all a blur right now. But still, those 3 pillars that I mentioned are very important to implementing programs. So keep that in mind. But mental health, housing, workforce, and primary care. Mental health, housing, workforce, primary care. And, you know, I mean, I don't know how deep to go into any of those. Those are all core fundamentals of people living. But I think one of the challenges is that funding often requires us to silo our programs and often requires us to be very program focused. And I think there needs to be a revitalization of community centers, much more robust community centers. And so, you know, I guess Project Legacy, our hope is to try and at least pilot a model that might work. In which you can address housing, mental health, workforce, and primary care in one setting. Yeah, I don't know. Was that good? Did I do that wrong right? Okay, good. All right.
And so now this is a bigger theoretical question that goes back to a thing that we were all talking about a bit before, but it also connects up to this idea about like we have to be evolving and reimagining things. But since we are talking about systems, I'm wondering what thoughts the panelists have on dismantling systems. So I believe that a lot of systems were designed to harm marginalized people, and they have to be taken down and rebuilt. But I struggle with how we can work to change these problematic systems when we're all within the system that doesn't work. So I was wondering if any of the panelists would like to speak to that issue.
Yeah, sure. So great question. And the reality of the situation is, you know, we have to kind of take on this frame and this lens of anti-racism and anti-oppression, right? So, you know, do we need to dismantle all the system down to its bare bones? Probably not, but do we need to address the oppressive nature and the racist nature of a lot of systems that we operate in? Sure. Like, for example, you know, I'm on a couple of committees in terms of the social work profession, looking at how social work has, you know, further the system of oppression and white supremacy. You know, does that mean I can't be a social worker no more? No, it means that, you know, I come up, I offer my input, and we try to work on solving this issue. The other thing too is there are just some systems that do need to be done with, right? The reality of the situation is, you know, some systems are just kind of old and outdated. When we think about, you know, all the monuments that are coming down that represented you know, white slave owners or people that have caused harm to Black and brown people or people of color, you know, those systems do, because when we think about, you know, historic trauma and trauma in general, right, we don't want to continue that path. We want to look at how we can heal as a society, right, and come together to address these issues, right? So, you know, for people that are on this particular chat, right, think about what your own, you know, biases are. And the hard reality is that we all have biases. I think Gabriel identified it best when he talked about all his various identities, right? We all have these different identities that we have to address and that we have to come to terms with, that, you know, they certainly make us who we are, but they also come with some sort of bias, privilege, whatever you want to call it, that we need to also name and call out, right? So, you know, example, I'm a Black male social worker, right? It means that I am able to work with population, but it also means that I have a lot of privilege, right? Because that means I have at least a master's degree. It means that, you know, I have a cohort of people who have access and means to money. It means that I am also highly sought after in a profession that is largely dominated by white women, right? So, you know, in those regards, I have to think about what it means to be a Black male social worker and what it means to provide access to people and also open doors, right? So when we have the ability to impact the systems that we're working within, you know, it's our responsibility to do that.
Would anyone like to chime in on that? We have 1 more minute left. Or would anyone like the last words to round out our conversation for today?
Thank you.
All right,
yeah,
that is
it's humbling when people want to hear your thoughts, and I'm still getting used to people wanting to hear my thoughts. So I appreciate that, and it's a great space. And you know, I hope that we can create spaces where, you know, we can interact with everyone else's thoughts as well.
So yeah. I think. Oh, go ahead.
I was going to say thank you for, you know, just having us on this panel. You know, any opportunity that we have to have these conversations about social justice and, you know, the current pandemic, you know, means that, you know, we all walk away with more knowledge and more opportunities to impact change in the societies, in the communities that we work in and walk in. So I am humbled that you all, you know, spent an hour and a half, you know, chatting with us, listening to us and asking questions, and you know, hope that you take this information, you know, back into your circles and communicate it and continue to impact change within your community and amongst the people that you work with and surround yourself with.
Agree with all of that. And also a little bit of homework, because of course this is a class. So everybody, take a moment to think about not just how you can affect the structures that you reside within, but also how you can take your own privilege, whatever it is, to make change. As we are trying to, as Gabriel pointed out, we got to live with this. This is not going to go away anytime soon. So we got to make some changes and make sure that we can we can address the inequities that this is really highlighting. They aren't new. This is bringing it to the forefront. So let's take this opportunity and make some change.
Those are all wonderful last final remarks. So thank you all. I would like to give the panelists a round of applause. Please join me. Yes, and that is our session for today. Thank you once again. That was really informative. It went in ways I didn't quite expect, but I think that a good conversation will. So thank you.